Starting immunotherapy brings both hope and uncertainty. It is completely normal to feel unsure about what lies ahead, especially when you hear others talk about side effects. The aim of this conversation is not to alarm you, but to give you a clearer understanding of what may happen, why it happens, and how to navigate it with more confidence and less fear. When people begin immunotherapy for melanoma, the focus is often on the treatment itself and what it promises. Immunotherapy is one of the biggest turning points in cancer care. It has helped many people live longer, better, and with more hope than we ever thought possible, even just a few years ago, especially for melanoma. But alongside that hope comes a quieter question. What side effects should I expect? Understanding these, why these things happen, and what is going on inside your body will give you more confidence and more courage to weather them. In this video, I want to gently walk you through the three most common side effects of melanoma immunotherapy. Not the rare ones just yet, not the dramatic ones, but the ones real patients every day face most often in everyday life. Fatigue, skin reactions, and thyroid changes. Each of these tell us something different about our immune system, how it behaves when it's switched on to fight cancer. Fatigue is a side effect experienced by almost everyone on immunotherapy, but very few people truly understand it. Your oncologist may not have explained it this way. This is not the tiredness of a late night or poor sleep. It is a deep heaviness, as if someone abruptly turned off the lights on your energy. You feel heavy, almost like an inert blob. Gravity seems stronger. You're wading through mud. It is not dramatic, but it is persistent. The reason it happens is simple. Immunotherapy does not attack cancer cells directly, it activates your own immune system. And once stimulated, the immune system burns energy because it is constantly on the move, scanning, reacting, adjusting, the same way a slow fever works. That takes effort from the whole body. The good news is that this kind of fatigue is often a sign that your immune system is awake and active and hard at work for you. What helps most are the small habits. Think of it as working with your body rather than pushing it. Short walks, even when you don't feel like it, light stretching, feeding your body with regular small meals that include protein, staying hydrated, gentle pacing of your day, not forcing yourself to focus if your mind is foggy. Don't push. Resting often, even short rests throughout the day without feeling guilty. And if the fatigue becomes overwhelming or suddenly worsens, tell your doctor. Sometimes it's simply the treatment. Sometimes it is the thyroid, which brings us to our third side effect after we talked about skin reaction. Skin reactions are incredibly frequent because your skin is the largest immune organ in the body. When the immune system is activated, the skin is one of the first places that it shows. The rashes can be varied: dry patches, pink, bumps, eczema-like flare-ups, or just a generalized itch without any visible rash at all. Most of these are mild and easily managed. Some moisturizer, a gentle soap, and a light steroid cream usually helps. It is important to remember that these reactions are not allergies to the drug. They are signs of the immune system drifting close to the skin, the same mechanism that is working to recognize and attack melanoma cells. But sometimes the immune system wonders. When should you be concerned? If the rash becomes painful, if it covers a large area quickly and forms blister. Those are signs of a stronger immune response and should be reviewed early. But most rashes settle with simple management and they do not require stopping immunotherapy. Now let's talk about the thyroid. About 10 to 20% of people on immunotherapy develop some form of thyroid disturbance. This is not as scary as it sounds. The thyroid is sensitive and reacts quickly to immune signals. Sometimes it becomes overactive for a short time. You might feel jittery, sweaty, or notice a fast heartbeat. Then it swings the other way. It slows down. Then you'll feel cold, your energy drops, your mind feels foggy, fatigue sets in. This pattern of a brief overactive phase followed by a longer underactive phase is very common. Know that the thyroid changes are simple to detect and simple to treat. A basic blood test picks them up early. If your thyroid becomes underactive, you take a replacement hormone, a tiny tablet once a day. Many people stay on it long term, and that is completely safe. What matters is that you do not ignore the symptoms. If you feel off in any way that is hard to describe, tell your doctor. When we look at these three common side effects together, a pattern emerges. Immunotherapy side effects often reflect the immune system doing its job, but straying a little into healthy tissue. Fatigue is the whole body feeling that activation. Your body is working. Who says it's doing nothing? It's working. You are working and doing incredibly a lot. So give yourself a pat on the back. The skin is the immune system expressing itself on the surface. The thyroid is the most sensitive gland to the immune signals, and none of these effects mean that treatment is failing. They're simply reminding us that the immune system is powerful and responsive. What should you do if you're experiencing any of these? The first step is to notice them early. Just be aware of what it feels, of what feels new, what feels different, and what feels persistent. The second step is communication. Tell your oncology nurse or your doctor. These side effects are common and expected. They're not signs of weakness and they're not inconveniences. They are physical manifestations of the cooperation between your immune system and your treatment. The next step is to remember that you are not alone. Every week, thousands of people around the world are on similar journeys. Most manage these side effects well and continue their treatment without interruption. The key is early recognition and gentle adjustment. Immunotherapy is one of the strongest tools we have against melanoma. Understanding the common side effects helps you approach it with confidence rather than fear. Fatigue, skin changes, and thyroid disturbances are manageable. They're not pleasant, but they are rarely dangerous. Knowledge softens anxiety. Awareness allows early action. If you found this episode helpful and revealing, and you know someone who is about to start or is going through melanoma immunotherapy, share it with them. Let them know the inside story that their body is working hard with the help of the immunotherapy to fight the melanoma cancers. If you want to know the other side of the story, stay tuned for the next part where we will talk about the three most serious side effects of melanoma immunotherapy. They are less common, but they matter. And knowing what they look like can make all the difference. See you there in the next episode.